Anterior cervical corpectomy is made easier by bone scalpel because the vertebral body can be removed en bloc, saving time and causing less bleeding. As usual, discectomies are performed above and below the level of the corpectomy. Bone scalpel is then used to make parallel cuts on either sides of the vertebral body. In this case, a right-sided cut has already been made, and we're now making a left-sided cut. With these initial cuts, we do not want to go all the way to the spinal canal. So the cuts are made about 2/3 of the way through the depth of the vertebral body, and then a rongeur is used to fracture and remove the anterior 2/3 of the vertebral body. This gives us better exposure of the posterior 1/3, and then bone scalpel is used to complete the cuts all the way to the spinal canal. Here, as the bone scalpel penetrates through the osteophytes that are associated with the posterior end plates, the surgeon has to be very cognizant of making sure not to plunge into the dura. As the posterior cortex of the vertebral body is cut, the vertebral body is mobilized and removed en bloc. I would not recommend this en bloc technique if there is any reason to suspect that the bone is attached to the underlying dura. Specifically, this would not be a good choice for ossification of posterior longitudinal ligament, where en bloc removal of the vertebral body could cause ripping the dura and potential injury to the underlying spinal cord. Once the vertebral body has been removed, the posterior longitudinal ligament is exposed and resected. In this case, there is a thick epidural phlegmon that is being removed, and the dura is then exposed and decompressed. Then a standard bony fusion and plating is performed.